So one of the things that that we see commonly in all of our practices is that people come in all the time with issues in their low back, with issues in their spine, pain running down their legs, and what we're basically trying to do is find a way to get as much help for these for you and for those patients as we possibly can. And so what we've been calling the spine clinic at Henry County Medical Center is not necessarily a brand new thing as far as what we're actually doing. For a long time, you know, you've probably gone to one of your doctors. If you come to any orthopedic surgeon's office, you may have been sent for an epidural steroid injection in your back, for an ESI, a nerve block. There's all kinds of different terms that have been placed on those. Typically, that's been one type of injection only. What's happening now is that we actually have some additional injections. When we talk about spine injections, not all spine injections are created equal. There are very different ones, and it depends on what your problem is as to what type of injection you need and what would be the most beneficial. And we basically, and what the spine clinic will offer is a chance to get nearly to all of those addressed here at home. We like treating as many patients as we can here in Henry County, so you don't have to drive to Jackson, Nashville, Memphis, or other cities to get your care. And so whatever we can do to help with that, that's what the spine clinic is about. Why a spine clinic? Part of what we already discussed. When we deal with spine issues is one, there is a tremendous need. If you have not had low back pain at some point in your life or have not had sciatica at some point in your life, you know somebody that has. And oftentimes, as patients are living longer, as our life expectancy is going up, the chance of arthritis to do what arthritis does, and particularly in the spine, to pinch on nerves, to crowd the nerves that are running down through your back and running down your legs, and to cause you symptoms, those continue to progress. And so as life expectancy is climbing north of 80 years old, average, we're going to have a lot more of this. The longer you live, you wear out your back. One of the more common conversations I have with spine patients that show up in my office is they'll come in and they'll be very concerned because a doctor once upon a time told them that they had that thing called degenerative discs, and that they're really concerned that they're degenerating. And what I try to reassure them is that just means they're still alive, is really about all that means. That's a fancy way to say arthritis. That's a fancy way to say you're still above dirt. That's happening. That's going to happen to all of us. And so degenerative disc disease is a reality that we all face. Some of us get it earlier than others, but that's part of why we're here today. So there's a huge need. Another part of that need is that the resources to treat these issues are limited. Most of you know, or many of you may know, that CPS was a pain clinic that did pain management injections for a very long time, had clinics scattered out all over Tennessee and the Southeast. They closed several months back, and so those are not available. We sent a lot of patients from Henry County to Camden to get these types of injections, to get pain management. And a lot of these are spine patients. And so we sent a lot of patients south. We sent you to Jackson, we sent you to Clarksville, we sent you to Memphis, Nashville, for these types of injections. Well, CPS closed. We don't have that option anymore. There are some new ones that are opening up, but it's been very slow, and all of our clinics got very crowded very quickly with patients that have issues with their spines and need injections, and they didn't have anywhere to go. If you've been in an orthopedist office, you've heard us mention that the laws have changed a whole lot when it comes to, particularly when it comes to prescribing medicine. It used to not be nearly as big of a deal for people to go see a doctor, go see a PA, go see a nurse practitioner, and get pain medication that helped them kind of get through their day. Those days are by and large ending very quickly, if not already over. where as in the laws have changed, it's very much more difficult for people to do that. And so with the laws changing, with clinics closing, there's a huge need. Basically, this is a joint effort. The spine clinic is basically a joint effort between the hospital. Primarily, it'll be at Kelly Clinic, and involving staff from Innovative Orthopedics, as well as myself as a part of West Tennessee Bone and Joint. And so, but the primary location of this will be at Kelly Clinic, right here behind the hospital. And basically, this is an opportunity to try and give non-operative care or injections and that sort of thing, non-surgical care for people who have issues with their low back or issues with sciatica, pain running down your legs, those sorts of things. And so the team will basically comprise of myself and Chris Gulish will be seeing a lot of these patients primarily. He's a PA. He's been seeing lots of spine patients for many, many, many years, and so he will be largely the point man that, from an appointment standpoint, at the spine clinic, that you will see. That if you go to the spine clinic, you'll meet Chris. He'll do the exam. He will look at your studies, and then he'll talk to me. And we'll look at MRIs together, and we'll put together a plan of kind of how do we do this. What do we think you need from an injection standpoint, and then go from there. And then we'll order those injections. Now the injections themselves will be done by one or two of our CRNAs here at the hospital. Now, many of you have already probably maybe even had injections here by them. Andy Rice and Eva Harden are two that have gone to special training. They have been here for years. Andy's here in the back, and I think Eva's upstairs, probably in surgeries. But Andy and Eva will be actually the ones doing these injections. They have done special training. They've done injections for years. And so this is not necessarily new to them. I will offer my vote of support to them. I would be happy to send my family and let them inject them. What I do tell people is that obviously if you want to travel out of town, we'll be happy to set those referrals up. If you prefer to go to Jackson, Clarksville, Memphis, Nashville, that's no problem. But having them done here, I would have no reservations whatsoever about sending family to them for injections in the low back. And so it'll be one of these two. If you've had an injection here, you've met one of them, because one of them has been the one to do your injections. And so they will be the ones that whenever we get an injection ordered for you, they'll be the ones that actually stick it in your back as far as that goes. I do not do these injections. I prefer to cut. I do not prefer to stick. And so they are very good at doing these injections, have done them for a long time, and we'll talk a little bit more about that in a second. What is available here? Let me be very, very exquisitely, blatantly, overtly as clear as I can get. This is not a pain management clinic. And so do not go tell people this is a pain management clinic. And there are several things available. What this clinic will offer you basically are everything short of surgery. Basically everything short of surgery is available. From a medication standpoint, giving prescriptions for anti-inflammatories, for muscle relaxers, for even nerve modulating or agents like gabapentin, Lyrica, those are fine. Those are available. We don't mind doing those. Beyond that, it's not coming from this clinic. And so if you're receiving narcotics from somewhere else, or if a patient is, or you want them, you're going to have to get those elsewhere. And so this is not a pain management from a pill standpoint. What our job here is to try and deal with whatever problems we can address, whether it be medication, whether it be physical therapy or chiropractic referrals. If you haven't done that, or if you haven't done that in a while, if you see Chris, that may be something that he recommends. Those referrals for therapy, readily available. That will not be a problem whatsoever if you need those referrals. The MRIs and CTs, to get injections in your spine, it will require an MRI, or if you cannot have an MRI, it will require a CT scan for advanced imaging. to look more specifically at what is going on in your low back and proceed from there. And so Chris will either order those, he'll review them, I'll review them for people getting injections, and we will look, and so that, and the CRNAs will review them. And so there'll be several eyes looking at your MRIs whenever you go through the process of getting an injection in your low back. The injections themselves, Chris will help order those. From a paperwork trail standpoint, you will follow up after the injection with him, and he and I will get to talk and text a whole lot to converse and say this worked, this didn't. If some of your MRIs, I mean, it's pretty obvious a lot of times, some of your MRIs are so badly arthritic and so badly worn out that you need surgery. Sometimes those referrals are necessary, and so Chris can make those. We can get you to a neurosurgeon, to a spine surgeon, whether that be Nashville or Memphis, if you need something more than we can offer. And so this is what the spine clinic will be available to do. Everything below that. Well, we will not be doing any narcotic medications. We want to make sure that is perfectly clear with what we're doing. Now, from the injections themselves, these injections will only be lumbar spine. That's low back. And so when we look at your spine, we divide that into cervical spine, which is a fancy way to say your neck, your thoracic spine, which is basically your rib cage, and we will not be doing injections at those levels. The reason being, the way God made your spinal cord itself, the big nerve, the nerve, runs from your brain down your back, and it stops at the bottom of the thoracic spine, at the top of the lumbar spine, or the low back. Below that is a series of nerves that run in a sac that's filled with fluid, and those are the nerves that get pinched by herniated discs, that get pinched by bone spurs, that get pinched by discs that have collapsed, previous fractures, all kinds of issues. Those are the nerves that we're going after. So this will be low back injections only. It's no problem. I mean, if to be evaluated, but as far as an injection standpoint, and the focus of this clinic will be lumbar injections. So low back issues. So low back pain running down your legs, sciatica, pinched nerves, radiculopathy, whatever term you want to put on it. These injections will be there available. Now, as far as the logistics of this, again, this will primarily be located at Kelly Clinic, where Chris Gulish works with Innovative Orthopedics. Do I have this phone number right, Jeanette?
644-2271 would be the best number.
Okay, so ignore this slide whatsoever. So, what's that again, Jeanette?
644-2271.
644-2271. Is this like the laundromat? What number did I put up here?
That number does go to the clinic, so really either number.
Okay, but better would be 2271.
Yes.
644-2271. Okay, good. What will happen is basically this will crank up next month, 1st of May. Is kind of when Chris will start seeing patients. Now, you may come into, there'll be lots of different options for you to get these injections. Some of you will wind up coming into to my office for other issues. If we find out you need a back injection, I'll order whatever back injection I think you need. I send you over. Andy or Eva put the needle in your back, and we do that. Some of you may follow up after that with Chris and see him at that point. Typically, when we do injections, some of these injections you can get a series of 3 that are scattered over a matter of a few weeks in between, or get a series. And so those repeat visits, a lot of times Chris will help manage those. If you show up after your first one and you're feeling great, you don't have to have a second one. If it helped a little bit, you're better than you were, but you still have pain. Having a second one or maybe even a third one would be very beneficial. And so, but we'll help decide that in conversation with you. Many of you, you may go see your primary care physician, whoever that is, and we'll be in touch with them. And if you have low back issues, you could be referred straight to the spine clinic from that office. You don't have to see an orthopedic surgeon first. You don't have to see me or Chandler or Cutright or Melton first before you go see Chris. you can go straight from your primary care to his office. And then he starts it from there. If you don't have an MRI, you're going to get one. If you haven't had therapy, you're probably going to get some. And so this will primarily go through Kelly Clinic as far as that goes. I don't have an official launch date, but 1st of May is what I've been told early on, and we'll be taking appointments and that sort of thing. And so basically, if you want an appointment, if you think, hey, I'd really like to do this, that phone number, 644-2271, would be a number that you could call and say, hey, I'd really like to be evaluated at the spine clinic. It'll be sometime early May is what we're doing. As far as, we recognize there's a great need for this. We don't know how big of a need. We do expect this to grow. We expect this to be a fairly significant need for the people in Henry County. And so we will accommodate and adjust as the need forces us to adjust. And so this is an experiment of some sort to try and formalize and give a little better organization to something we've been doing a long time and go from there. And so with that, we're excited to do it. We hope it's a helpful resource for you to be able to stay home and to get the care you need.